Minister of Health and Social Welfare, Professor Mohammed Ali Pate. He served as Minister of State for Health in 2011, as well as the Executive Director, National Primary Healthcare Development Agency. He also had a stint as Professor of Public Health Leadership, Harvard University, and at Duke University, all in the USA. You're welcome to NTA Network News.
Thank you for having me.
It's nice having you. And Prof, you're hosting the health sector's first joint annual review, along with all 36 states' health commissioners, donors, and development partners. And the key plan of this event is one plan, one conversation, one budget, and one M&E process. What will this achieve? Can you just tell us about that?
Well, under the leadership of Mr. President, his administration has embarked on ambitious reforms, which were launched last year. And the federal government signed a compact with all state governors, local governments, development partners, as well as civil society, for us to respond to Nigeria's citizens' needs as it relates to health and to improve population health outcomes, to do better in investing in those things that attend to the needs of our most poorest and vulnerable populations, our women, our children, who are the future of this country, who will fit into the prosperity that is in this country's future. But as part of that effort, governance is key. And that requires us to be transparent, to be accountable, and to use good information, good data, to take stock of the progress. Now, a year on, we have called on this first joint annual sector review to look at the progress that has been made, to take stock of what has worked well and where we need improvement. And we have very good data from the DHS survey, which had looked at 46,000 households and evaluated the state of health of Nigerians, but also a public perception survey where 2,600 Nigerians were asked their perception, their confidence, what is going well and what needs to be improved. It's an iterative process. But as we learn from that, we will continue to refine the journey, ultimately to achieve the objective that we set for the reform agenda. And we're seeing some elements of good news. Early, but still, children's health has begun to improve if you compare DHS 2018 to the DHS that was conducted by October, November, December 2013. Modest, but we have also seen reduction in certain key elements, diarrheal diseases, lower respiratory infections, HIV. This is based on rigorous data, independently collected. But in terms of the perception survey, we've also seen the confidence of Nigerians has been revived, and I think it's thanks to the leadership of the President and what his administration is doing across sectors in terms of the ability of the government to respond to emergencies. We're seeing more confidence in terms of the quality. It's not yet there fully, but we're seeing signals that shows the confidence is returning in terms of direction of the health sector. We're also seeing increase in access to healthcare service based on this survey instrument. Hypertension, diabetes, certain cancer screenings. But we're also seeing not so good news. Less women are going for mammography, which is important to screen for breast cancer, for instance. We're also seeing that the increase in access to healthcare is coming at a cost that is burdensome to families. So financial risk protection is an area that we have to work on. We have seen increase in insurance coverage, mostly public health insurance. 2.4 million Nigerians through NHIA, through the state health insurance, have had coverage to afford health care through the Vulnerable Groups Fund. But we have not seen as much improvement in the private health insurance. That is work for us to do. We have seen improvement in use of modern contraceptives in 21 states in the country between 2018 to 2013. And we've seen doubling in at least 6 states. But it also means that it's a lot more that we need to do to sustain these efforts. So all in all, these efforts will be put into the first State of Health report that we will present to His Excellency Mr. President, to the Parliament, but also to Nigerians, so that we have this dialogue for us as a nation to co-create the healthier country under the leadership of the President, but with the support of all the state governors, the local governments, the partners that are supporting the Nigerian government, civil society, and to respond to the needs of Nigerians. Because at the end of the day, that is the focus, with their health and well-being as co-part of this vision that the President has for a peaceful, prosperous, and people-oriented country into the future. But those investments have to happen now, and that's what we're working on. And this week is an important milestone for this overall reform.
Yes, indeed, no country can thrive without a vibrant health sector, and the primary health care, is very, very important to dispensing of, health issues in Nigeria. Now, you talked about data, you talked about survey. What role does public opinion play in shaping health policies in this dispensation, especially in the area of high cost of drugs?
Well, we have been expanding the functionality of our primary healthcare centers, retraining frontline health workers, expanding the capacity of our teaching hospitals, establishing cancer infrastructure and equipment, revamping, and also expanding health insurance to ensure affordability, not only for routine services, but for complicated emergency obstetric care, like cesarean section, treatment of obstetric fistula by women who are affected by that complication. Now, all of that has to be connected with what the views, what the experiences of Nigerians, both in terms of their population health, as well as their perception of the experience they have with our health system. That's why we calibrated that in 2023 with a People's Voices survey, and here this year in 2024 with another one. In addition, we have had several engagements with civil society organizations, because governance has to be inclusive for it to be effective. All voices ought to be listened to, heard, even if there are difficult decisions that government has to make because of limited resources. But with that in mind, the governance pillar of the President's health agenda really is about bringing all actors onto the table. Instead of a fragmented approach, federal government going one direction, states going another direction. Yes, states are different, and they are different within themselves, or local governments. We have to join hands together. If there's one area that Nigeria can unite, at least on health issue, wherever you are, whatever level of government you function, health affects you. And that's what the President is trying to use, in fact, to help heal and unify, but also advance this vision that we can have a healthier, more prosperous country if we invest in the health of our people and we don't leave anyone behind. Our women, those who are poor, that they should afford the most basic healthcare services. And that's what we're working on. And the journey has started. We are far from where we need to be, and we are not perfect in the way we're executing it, but we are determined to diligently execute this reform agenda to achieve the results that improves the health outcomes of Nigerians over time.
So how are the subnationals keen into this?
Very interesting, because they all signed onto the compact and appointed desk officers in each of the states. Their annual operational plans have been developed with the federal government, so that we have one plan, in a way, which is comprising of all the plans of the states, aligned with priorities that we set for our country, so that our development partners are not setting the priorities. We set our priorities and they key in. In addition, the resources that domestically state governments are putting, local governments will put in, federal government puts in, and the President has increased the resources in 2024 to health, and we expect that increase to be sustained and in fact further increased in the years ahead, along with development partners, so that they also identify where there are gaps that are aligned with our priorities. And if they go outside that, then they are distracting us. So with that in mind, we also have to keep track of the performance, because you cannot focus on the investment side without looking at what results are we buying for Nigerians. It is that approach that has informed this first ever joint annual health sector-wide review that is happening this week. It has never happened and is an important milestone. But it's also one that challenges us, because right now we're seeing that there is an element of progress, but we need to sustain it and to keep it up.
Indeed,
now, states are learning,
yeah,
and we have scorecard for each state in terms of how they have been, and we will learn from those who are doing well. For those who may not be doing well, they can learn from those who are doing well and collectively improve, not judge each other, but really work towards improving the delivery of services for our population.
Indeed, the challenges are surmountable, and I believe Nigeria can get to the highest level according to world best practice in the health sector. Thank you so much.